It's time now for Health Watch. As always, Dr. Syed Hussain from Trinity Health of New England joining us. Really interesting topics. I'm really excited about these here. First off, the FDA's latest report about traces of the bird flu found in pasteurized milk. A lot of people are saying, uh-oh, should they really be concerned, or is this not that big of a deal?
Yeah, so long story short for viewers, don't be alarmed. The commercial milk supply in the U.S. is safe. What the FDA commented earlier this week, Erica, was traces of virus that were found because they use a very highly sensitive PCR test to detect bird flu. And it may be just inactive material from the virus. And we've seen this play out before a couple of years ago when we were in the midst of the COVID-19 pandemic, when very sensitive tests would pick up some virus material. Now, the FDA is conducting further analysis and testing. This is the first time viewers should be aware that bird flu was detected in dairy cattle, in milk. And we've had 2 instances of animal to human transmission. One recently, which presented with conjunctivitis, which is eye infection, pink eye. And then 2 years ago, when we had someone with mild fatigue. Both cases have recovered, though, since they were diagnosed, so that's good news.
So don't cry over the tainted milk just yet.
That's right.
Okay. All right, moving on. We've been talking about PFAS, or forever chemicals, for several years now. And recently, the Biden administration just finalized new rules to limit these forever chemicals in our drinking water. But what can we do at home on our own to limit exposure?
Sure, yeah, these are problematic chemicals, and the forever chemicals term you use is absolutely correct, Erica, because they stay, once we ingest them, once they're in our bodies, they can potentially stay for decades. They've been linked to cancer, fertility issues, high cholesterol, a whole bunch of, yeah, absolutely. They've been linked to a whole bunch of different chronic medical problems. So what you can do to stay safe is, first and foremost, check the level of PFAS in your water supply. Contact your local water supplier to check what it is. If they don't have an answer for you, or if they are not checking for, especially these 6 PFAS chemicals that will be banned, then there's a commercially available test that can be done on that water to determine levels. The other thing you can do is under the tap, getting a filter. There are filters available that are safe and that are approved for safe drinking water. Reverse osmosis is a great mechanism. It's a little expensive, but great mechanism for safe drinking water as well. And then the other thing is, PFAS is not only in drinking water. It can be found in other things too, such as nonstick pans and cookware, for instance.
Right, and takeout containers.
Absolutely. So
Tupperware, things like that.
100%. So things to be careful and aware, because if we have alternatives, we should definitely use those, because as I said earlier, these chemicals, once in your body, can last for a very long time.
Yeah, my kids say I'm crazy that I say, don't microwave food in a plastic container. Use a glass plate. They think I don't know what I'm talking about, but you know what? It's serious.
Yes,
it can have real effects.
That's right.
All right, let's talk about this new thing, full body deodorant. We've been seeing a lot more of it. Keith was saying that it keeps popping up on his Facebook ads. What's this all about? Why the emergence of it? And is it something that we actually really need, or is this a marketing thing?
So from a medical standpoint, the short answer is no. Okay. We don't need it.
That's what I thought.
So if you do have an issue with body odor, there's, you can use deodorants, but in certain areas such as armpits, for instance, or feet, but to use it all body is probably not recommended.
Right.
Keep in mind there's some folks out there that may be very sensitive to some of these fragrances, Erica. It can cause skin rash or irritation or redness of the skin. There are some people out there who are very sensitive to fragrance in terms of neurological symptoms, so developing a migraine or a headache. And then it's always, you always need to be careful, especially applying such products in the groin, especially for women. You don't want to use it inside the body because you don't want to upset the vaginal microbiome, for instance. So all of these things need to be considered. And if you're really bothered, think about an antiperspirant, for instance, which will decrease the amount of sweat, or antibacterial, which will decrease the amount of bacteria on your skin, which actually does cause the odor, not the sweat itself.
Right, right. Because it's important to remember that there are other products in these deodorants that aren't necessarily natural, and it's not good to cover your entire body with it.
That's right.
But there are serious medical conditions, right? If you do have a problem, and you can see your doctor about that.
Oh, absolutely, 100%.
What are those medical
Yeah, hidradenitis is one of them, which can be very foul smelling. It can lead to a lot of different skin lesions on the body. So if you have a persistent problem, then it's always good to get checked out and see a healthcare provider.
Yeah. All right, Dr. Hussain, thanks so much.
Thank you.
We do appreciate your time.
Absolutely.
Good topics, right?
Yes, absolutely.
Yeah, I know a lot of people at home are wondering about that.